Let us summarize the lung ultrasound in minutes. It is now the modality of choice to assess lung diseases, a choice by evidence recommended by the American and the European societies on medicine and intensive care. Remember the number 4. Lung consists of 4 letters. So everything in this video will be related to number 4. First, the good news about lung ultrasound, and number 4, that the 4 probe types can be used. Any one of the lung ultrasound probe, either linear, phased array, convex, or hockey stick. Any one of them can be used to assess lung by ultrasound. In neonates, we scan 4 zones on each side: upper, lower, anterior, lateral, and then costophrenic angle on each side. We have 4 zones on each side. In adults, we have also 4 zones to be assessed: anterior, upper and lower, lateral, upper and lower on each side. We have 4 main patterns of lung ultrasound. The first pattern is A lines. If you have A lines prominent, this type of ultrasound artifacts reflects air either in the normal lung or outside the lung in pneumothorax. How to differentiate between both is easy. Just watch sliding of the pleura. If there is a sliding, this is normal lung. If no sliding, silent pleura, then it is pneumothorax. It is the same pattern in all ages: neonate, children, and adults. Then the second pattern is B line, and B lines are separated and countable. And if we have more than 2, 3 or more lines, then it is consistent with the interstitial fluid. In neonates after birth, this is consistent with the TTN. And children and adults might be consistent with heart failure. Number 3, the pattern number 3, when B lines are fused, baking line whiter or brighter, which is consistent with RDS in neonates after birth, alveolar edema due to heart failure, or acute lung injury at any age. Then the pattern number 4, if the pleural line cannot be seen in presence of white dots of air bronchogram, such as atelectasis due to small lung volume or minimal air, which could be an RDS after birth or acute lung injury at any age. But it could be fluid content. If we add more fluids to the lung, then the lung appears more consolidated and more hypoechoic, which could be consistent with pneumonia or consolidation due to any reason. We can also score the lung numerically. So the first pattern with A lines considered as 0, score. The second pattern was separated B lines, score as 1, regardless how many B lines. Fused B lines considered as a score of 2. And then presence of air bronchogram or fluid bronchogram considered as a score of 3, the highest score. And then if we score 3 zones on each side in neonates, we are talking about total highest score of 18. In children and adults, we are scoring 4 zones in each side. So the highest score is 24. And if we include another 4 zones on the back, 2 on each side, then we're talking about highest score of 36. So I hope that I summarized lung ultrasound clearly, and welcome to join any of our online courses and workshop. Thank you.